is too short not to get out there and enjoy it, but if there are two things holding you back, neck and back pain, then you need to go ahead and come see Dr. Miller at Total Health Chiropractic, like so many other people have had, like Carol that's sitting here, and we'll get to her story in just a minute. But Dr. Miller, you provide a non-invasive way for people to get back out there and enjoy the things like gardening, playing with their grandchildren, and so much more.
Absolutely, Leanne, and that's really what it's all about. You know, we see so many patients coming in that have struggled with these problems for many, many years, and you know, they go down the common route of drugs and physical therapy, sometimes injections at the pain clinics. Many of them even end up getting neck or back surgery. And, you know, when they come in, it's sort of a question that we'll ask is, are you just surviving, or are you actually thriving with your life?
Yeah.
Because, you know, people don't want to just survive. They want to do those things that you mentioned and enjoy their life and enjoy their family and be functional again. But we've said it before, the issue with those treatments is they're treating symptoms and just trying to mask those symptoms. They're not really correcting the cause of their aches and pains, and that's why the problem persists and they have to keep doing those treatments over and over again. So our treatments that we offer here are non-invasive. We don't involve any types of drugs, no injections, no surgery, and our focus really is to get the problem corrected so that they can go live that life and, you know, enjoy it again and not just, you know, survive each day.
Yeah, so how does this all work, the DRX?
So this is called True Non-Surgical Spinal Decompression, or DRX 9000 therapy, but it's a medical device, and when we can determine which levels of the spine are causing the pinched nerve, it can actually gently stretch and work on that area of the spine through the aid of computers, very specifically, where it can actually regenerate the discs in the spine so that, you know, that pressure comes off the nerve and they're able to go function again, because we're getting the spine and the discs healthier. And just knowing that, you know, we're not just covering it up, we're really making changes so that they can go live that life they want to live.
And we talked at the beginning about Carol here. Tell us a little bit about her situation, and we'll talk to her a little bit more about how debilitating her issues were.
Yeah.
But from your perspective, what did you see when she first came in here?
So when we met, we sat down and talked quite a bit about what she's been through, you know, not only what her complaints were, but the type of treatment she's been through. We've talked about what activities she could or couldn't do or how it affected her spine. But she's been through a lot, and she tried a lot of different treatments to try to get relief. But I mean, she can speak for herself, but it was not a life much more than surviving, I would say. And so, you know, we were able to do a physical examination to check her function with her back and her legs. I think we took some x-rays, and I pulled this up and I showed Carol what the problems were. And, you know, as we went through the course of determining what the issue was, I felt she was a very good candidate for DRX therapy. And I offered her a program and talked about what it would take start to finish to get that problem resolved. And she took me up on it, and I think she's very, very happy she did.
Well, Carol, thanks so much for sitting down here with us today and sharing your story with everybody. Let's go back to when this pain was so debilitating and how it took away your quality of life.
I've been dealing with it for actually several years now. I noticed it was actually getting much worse about 2 years ago when my youngest granddaughter was born. And I actually couldn't sit and hold her for a very long period of time without feeling like I was going to drop her. So I knew, at that point, I guess, is when I went to go see the neurosurgeon, and he told me that the only thing he could do was rods in my back. I'm a registered nurse, and I've seen plenty of things happen with back surgery, and I didn't want to go that route. So I kind of kept my eyes and my ears open, but nothing was actually coming, you know, in my direction until a friend of ours saw him on TV one day and was telling me about his program. So me, being the nurse that I am, got into digging into it and doing my investigation and research, and talked with my husband and decided I've got to try it. I've got to try it because I don't want to go into the back surgery thing if I don't have to. So we made an appointment and we came up and talked to Dr. Miller for a while. And I was skeptical at first, but I was willing to at least put myself out there and go through it and try it.
Yeah. So now you are kind of a graduate of the program, we'll say that much. So how are you now?
Well, I've gotten back into a little bit of gardening. I have to be careful, of course. You know, I have to, I can only do so much at a time, but at least it gets me off my chair. I can actually do housework. And I can actually spend time with my granddaughter. We actually have a brand new great-grandson too that I can actually hold for a length of time. You know I'm not 100%, but I need to keep working at it, and
Absolutely.
I plan to do that.
Well, I'm glad you're doing so much better.
Thank you.
Great. So many people out there are watching right now and they want to learn more. And you have an upcoming seminar for everybody?
We do. So we have a seminar coming up. It is free and they're allowed to bring one guest, but we only have limited space, so it's important that they call our office or schedule online to reserve that spot. But it'll be in our presentation room here. We have quite an open area with a lot of desks and chairs, and I'm going to be presenting and talking about what can cause chronic neck or back pain that many attendants probably are suffering from. And we're going to talk about common solutions and treatments that are out there, and especially talk about DRX 9000 therapy and how it actually works and what it does. And we may have a couple patients volunteer to come give a testimonial. I know we gave you a picture. Jerry had come out before and he was donating his cane to us at the seminar because he went through the program and he just didn't need his cane anymore. So it's a very educational, it's maybe about an hour long, but I've had people there that it's like a light bulb going off in their head where they finally understand why they've been hurting so much and why they weren't able to get better results, and learn about what we can offer them.
Absolutely. And we have a new patient special for our Morning Mix viewers.
Certainly. So if they don't want to wait that long or they just don't want to go to a seminar, they can call our office today and we'll take $50 off that first visit to try and make it easier so that we can figure out what's wrong and hopefully find that they're a great candidate for these programs and we can help them as well.
Great candidate, just like Carol here.
Yes, thank
All right.
you.
Thank you so much.